everybody, and welcome back to another exciting episode on SpeechTherapyPD.com's YouTube channel. I'm your host, Stephanie Michele Sweigart. I am a licensed and practicing school-based SLP out in Los Angeles, California. My pronouns are she, her, and I'm here today with SpeechTherapyPD.com. And you'll see someone else on the screen because we have a truly special guest here with us today. We have a renowned expert in the field of speech pathology who has developed an incredible course that you must check out on clinical considerations in the assessment of spasmodic dysphonia and vocal tremor. And this is a topic that touches the lives of so many. And we are about to uncover invaluable takeaways from her course that could change the way that you think about vocal disorders. So before we dive into these insights, let's take a moment to introduce our guest to you, our guest who has dedicated her career to researching, diagnosing, and treating voice disorders. And her expertise is really information that is sought after worldwide. So without further ado, please welcome Christie DeLuca to our show today. Hello, Christie.
Hi, thank you so much.
Absolutely. Thank you for being here with us today. Where are you coming from? Tell us a little bit about where you are, or maybe some projects you're involved in.
Sure, absolutely. Yes, I'm out in LA as well. I'm originally from New York, but came out here about 2 years ago. And yeah, I am very passionate about voice disorders and spreading education, appropriate education on spasmodic dysphonia and vocal tremor. A few fun projects I'm working on. I'm a mentor and a coach for other speech language pathologists who want to get into the field of voice or who want to kind of build their competence in voice. So I have a few exciting things in that realm. And yeah, I'm excited to be here, and thank you for having me.
I love that. And I'm excited to learn about this too, because as a school-based SLP, we don't really work with a lot of voice disorder.
Right.
So that's not somewhere that I have a lot of, it's not a topic area that I have a lot of expertise in. So our field is so vast, and it's always so interesting to meet with different SLPs who have so much to share in so many different niche areas.
Yeah. I mean, that's one of the things I love about our field is that it's so big, but yeah, it's so fun to learn about different areas.
Yes, absolutely. Okay, so let's not keep our viewers waiting any longer. The golden question that we have for you on this episode really is, what would be 3 takeaways for anybody that's listening to really learn from your course that you have on SpeechTherapyPD.com called Clinical Considerations in the Assessment of Spasmodic Dysphonia and Vocal Tremor?
Yeah, so I think the first thing is identifying common challenges that we have to not only assessment, but also treatment. I think the populations of spasmodic dysphonia and vocal tremor are very unique and very complex often. And so there are a lot of challenges that we can face as clinicians to assessing, but also treating these disorders. And so I think it's really important to understand what challenges we might come across. And, that understanding can lead to better assessment, better treatment when we're armed with that knowledge. So I think that's the first thing. And then I think the second thing would be just understanding the differences, right? So oftentimes there's a lot of overlap between spasmodic dysphonia, vocal tremor, and then also similarly presenting disorders like muscle tension dysphonia. So it could be really challenging sometimes to understand what you're even working with when the symptoms are overlapping or when there's a lot of similar symptoms. So I think really getting a clear idea of what are the differences in symptoms and characteristics and what you can expect from each type of spasmodic dysphonia, but also vocal tremor and muscle tension dysphonia can really just give us a better toolbox for assessing these disorders.
Yes, and when I'm thinking about that toolbox piece, I'm thinking, okay, my brain works in checklists. So maybe if I had a checklist of symptoms under each one of those categories, it could kind of
absolutely
that would help.
Yes, and that's exactly what we're going to delve deep into, is like giving the checklist of this is exactly what you're going to see, and the complexities. It's not necessarily always a crystal clear picture. So I'm going to go into the complexities of what you might see with a complex patient as well with these disorders.
Okay. Excellent.
Yeah. And then the third one would be, I think, describing the clinical considerations for not only assessment, but also treatment, because I think we have a lot to think about for both choosing our assessment tasks that are fit for a complex neurological voice patient, but also our treatment, right? They might not respond in the same way that another typical voice disorder patient might respond. And so I think understanding what are those clinical considerations can help, again, really guide our clinical competence and create, you know, a better, more effective method for both assessment and for treatment for these patients.
Do you have an example of what one of those clinical considerations might look like?
Yeah, so I think so for treatment of spasmodic dysphonia, oftentimes patients are just referred for Botox injections, and that is kind of the gold standard of treatment right now. But there are so many other things that we should be thinking about and not just saying, go get a Botox injection. There's Botox counseling that we can do with our patients to really set expectations. There are side effects from Botox that not a lot of people are aware of. And we really want to counsel our patients on what to really expect. And there's a lot of considerations, even within that treatment modality. So dosing is a big consideration of like how much should they get in their injection. And then oftentimes voice therapy can be a really helpful adjunct or maybe standalone treatment if the symptoms aren't as severe. So I think most people tend to think Botox because it's a gold standard, and it is, but there are so many other considerations and so many other tools with education, counseling, and voice therapy that we can really be giving our patient versus just the recommendation of Botox, and that's kind of where it stops.
Sounds like a lot of education.
A lot of education.
It's a lot of handouts in your toolbox.
Yes. Yeah, lots of handouts and lots of conversations with patients of just, you know, I think that's where we establish hope with patients too. And that's one of my favorite things about working with this population is the hope that we can establish and the empowerment that we can give to our patients that they might not be getting otherwise if they don't meet with us or if they don't have those sessions with us.
Wow. This is all of the medical side of this is so fascinating to me. And I've always enjoyed learning about it. And I haven't been in the setting to work with voice disorders, but what for anybody that's listening, what would be typical settings where these would be your type of clients that you'd be working with?
Yeah, great question. So really any medical setting that you're working with adults, you know, I think we're maybe seeing more of these patients, and maybe hopefully that means that they're being better diagnosed and there's a better referral process from ENTs to us. But any place where you work with adults, so I would say outpatient mostly is where you're going to be seeing these patients, but specifically, or if you are a voice clinician, absolutely you're going to be seeing these patients. So you definitely, if you're a voice clinician, definitely want to be well versed in these voice disorders. But even if you're just working with adults in the outpatient center, outpatient setting, you definitely might come across a lot of these patients, and you want to know when you're coming across one of these patients and not be guessing as to what you're dealing with or what symptoms they're presenting with.
I love that. You are definitely an expert in this area. So Christie, tell us, for people who are listening that want to, aside from taking a deeper dive into this course, and I'll share the information for this course that you have, where can people find out more about you and the resources that you have?
Yeah, so I have a website. It's called speakingboldly.com. So SPEAKINGBOLDLY.com. And then you can find me on Instagram, Speaking Boldly. And that's kind of where I do some clinical mentorship, like I mentioned, and some trainings and a lot on neuro voice as well. So if people want to find me, that's kind of where I live.
All right, that's where you live. Aside from Los Angeles.
Right, exactly.
We'll have all those handles and links below this episode. So for anybody who wants just a quick tap and go to find you, we will have that posted below this episode here today. And I want to thank you for all this information that you're sharing, and obviously for all the information that you have on the course that's coming on speechtherapypd.com. And I just want to share with people that, you know, whether it's voice disorders or whatever niche you're in, or if you know a little bit about everything like me, I feel like I've always kind of just had a little bit of everything in our field because it's so big. We can always remember to bring mindfulness and compassion it can complement all of these and the clinical insights that you've gained today listening to Christie regarding spasmodic dysphonia and vocal tremor assessment. And I just want to remind people for self-compassion. We heard you talk today, Christie, just about, you know, there's a lot of unique challenges that come up in this field. And I think it's crucial to practice self-compassion. So just as much as we're striving and working so hard to support our clients tirelessly at times, right, to help individuals, whether it's with voice disorders or speech and language disorders, just take a moment each day to remember to show kindness and understanding to yourself as you're going through the process. Nurture your own well-being and don't be too hard on yourself when you're facing some of life's hurdles when you are working with your clients. And also remember mindful listening, right? So in the hustle and bustle of our lives, you know, we can often overlook the power of mindful listening. So really just taking the time to truly hear and understand the people that are around you, especially those struggling with voice disorders, because compassionate listening, it can make a world of difference in their journey towards healing and even in your relationship with one another. And then lastly, I would say this is not a topic that I hear a lot of information about. So it just makes me think about how can we raise awareness and support? Because when I think of spasmodic dysphonia and I think of vocal tremor, I know that it affects many individuals in the world, right, Christy? Yet
Absolutely.
the awareness about these conditions, I don't know, is it limited? Is there, I mean, I don't hear a lot about it.
It is limited. Yeah. And that's one of the reasons like why I'm so passionate about spreading this education, because it is limited, but yet there are many people struggling with these disorders. It's very important to raise awareness and raise our appropriate education. And yeah, I think that's one of our responsibilities as SLPs to do that.
Yes, exactly. One of our responsibilities. So we can share it with people that we're working with family, with friends, and it as just a way to offer that support and to create a more compassionate and understanding world that we live in. So thank you so much, Christy, for this enlightening conversation. I want to thank you, my heartfelt gratitude to you for taking the time to obviously share your course on speechtherapypd.com and your expertise and meeting with us today to give us these highlights about, you know, the information that you have and the resources on where to find you. So thank you for being here. And for everybody that's listening, thank you for tuning in. And remember, a little bit of mindfulness and compassion can go a long way in making our world a better place. Stay mindful, stay compassionate, and stay tuned in to our speechtherapypd.com YouTube channel. We want to see you back here next week as we're answering more of those golden questions that SLPs and SLPs are asking, and we're continually bringing in the industry-leading experts to give you the answers you need to step up your game and build your toolbox, like Christy said. For other topics, when you subscribe to speechtherapypd.com, you're going to get 1-year access to over 900 live and on-demand courses, and you're going to earn those ASHA CEUs. So if you're new to speechtherapypd.com and you haven't subscribed yet, you can actually access a free course. So be sure to check below this episode too for that link to find out more details. And if you found Chrissy's information helpful, go ahead and give it a thumbs up. Go ahead and comment below. We do want to hear from you. And again, we look forward to any questions that you have, and we'll see you back here again next week.